What are Candid V3 tablets used for? Candid V3 tablets are recommended for the treatment of candidal vaginitis, which is a fungal infection in the vagina caused by Candida species. How should the tablets be administered? They should be inserted directly into the vagina, as high as possible, using the applicator provided. When is the best time to insert the tablet? It's best done while lying on your back with legs bent, preferably at night before going to sleep. How often should the tablets be used? Adults should insert one tablet daily for 3 consecutive days. Can the treatment be repeated? Yes, a second treatment may be carried out if necessary. Is there a different dosage for elderly women? No, the dosage is the same for elderly women as for other adults. Why is it important that the tablet dissolves completely? Because if the vagina is too dry, undissolved pieces may crumble out. Moisture is necessary for the tablet to dissolve properly. What happens if a woman has vaginal dryness? She may notice undissolved pieces of the tablet, which is why inserting it as high as possible in the vagina at bedtime is important. Should treatment be done during menstruation? No, treatment during a menstrual period should be avoided because the flow may wash out the tablet. When is the best time to complete treatment? Treatment should be finished before the onset of menstruation. Can tampons or other vaginal products be used together with Candid V3? No, tampons, intravaginal douches, spermicides, or other vaginal products should not be used at the same time. What about sexual intercourse during treatment? Vaginal intercourse should be avoided in case of infection and while using this product because the partner could become infected. What if the partner is diagnosed with balanitis? If the male partner has candidal balanitis, he should be treated locally with Candid cream to prevent reinfection. Is this medicine suitable for children? No, it should not be used in children under 16 years of age. Who should not use Candid V3 tablets? Anyone with hypersensitivity to clotrimazole or the excipients in the product should avoid it. Is this medicine for oral use? No, it is for vaginal use only and must not be taken orally. Should the tablets be kept away from children? Yes, like all medicines, they must be kept out of the reach of children. When should a patient seek medical advice before use? Medical advice is needed if this is the first episode of candidal vaginitis, if there are more than 2 infections in 6 months, if there's a history of sexually transmitted disease, if pregnancy is suspected, or if the woman is under 16 or over 60. What symptoms require immediate medical consultation instead of self-treatment? Irregular or abnormal bleeding, blood-stained discharge, ulcers, blisters or sores, abdominal pain, painful urination, swelling or irritation, fever, chills, nausea, vomiting, diarrhea, or foul-smelling discharge. What if symptoms are not relieved after 1 week? The patient should consult a physician. Can the tablets be reused if the infection returns? Yes, they can be used again if the infection recurs after 7 days. Is clotrimazole safe in pregnancy according to studies? It is not teratogenic, but high oral doses in rats caused maternal and fetal effects, so caution is needed. Does clotrimazole pass into milk? Yes, in animal studies it was secreted into milk at levels much higher than plasma shortly after dosing. How should Candid V3 tablets be stored? They should be stored below 30 degrees Celsius, protected from moisture and light, and kept out of reach of children. What is the packaging like? The pack contains 3 vaginal tablets sealed in aluminum foil along with an applicator. How does clotrimazole work against fungi? It inhibits ergosterol synthesis, weakening the fungal cell membrane and causing cell damage. Is clotrimazole fungistatic or fungicidal? It can be either, depending on the concentration at the infection site. Can fungal spores be killed by clotrimazole? Fungal spores are only slightly sensitive, but the active growing forms of fungi are effectively inhibited. Is resistance to clotrimazole common? No, resistance is rare and has only been seen in isolated cases. How much of the drug is absorbed into the body? Only 3 to 10% of the dose is absorbed after vaginal application. Does it reach the bloodstream? Very little. Plasma levels after a 500 mg dose are under 10 nanograms per milliliter, meaning systemic effects are negligible. What do animal studies show about safety? They show no special hazard regarding repeated use, carcinogenicity, or genetic toxicity. What if the infection comes back often? If it recurs more than twice within 6 months, medical advice must be sought. Do Candid V3 tablets interact with latex contraceptives? Yes, they may damage latex contraceptives, reducing their effectiveness, so alternative precautions should be used for at least 5 days after treatment. Can they interact with other medicines? Yes, if taken with oral tacrolimus or sirolimus, clotrimazole may increase plasma levels of those drugs, requiring monitoring. Does clotrimazole affect fertility? There are no human studies, but animal studies have not shown effects on fertility. Can Candid V3 be used in pregnancy? It may be used during pregnancy, but only under the supervision of a physician or midwife, and without using the applicator. Is it safe during breastfeeding? Clotrimazole or its metabolites may be excreted in breast milk, so a decision must be made whether to discontinue breastfeeding or stop treatment depending on the benefits for mother and child. Does this medicine affect the ability to drive? No, it has no or negligible influence on the ability to drive or use machines. What side effects may occur? Allergic reactions such as rash, itching, or swelling may occur, as well as local irritation like burning, redness, pelvic pain, or vaginal bleeding. Some people may also experience abdominal pain. Is overdose possible? No significant risk of overdose exists because systemic absorption is minimal. If swallowed by accident, symptoms like nausea or vomiting may occur, and gastric lavage may be considered. How exactly does clotrimazole work against fungi? It works by inhibiting the synthesis of ergosterol, which is an essential component of the fungal cell membrane. Without ergosterol, the membrane becomes weak and dysfunctional, causing the fungal cells to die or stop growing. Is clotrimazole effective against many fungi? Yes, it has a broad antimycotic spectrum, acting against dermatophytes, yeasts, and molds both in laboratory studies and in real-life treatment. What concentrations are usually effective? The minimum inhibitory concentration, MIC, values for fungi are usually between less than 0.062 micrograms per milliliter and 8.0 micrograms per milliliter. Is clotrimazole always fungicidal? No, it can be fungistatic, stopping growth, or fungicidal, killing fungi, depending on the local drug concentration at the infection site. Does clotrimazole kill spores? Not effectively. Fungal spores are only slightly sensitive, so treatment mainly targets actively growing fungal cells. Is resistance to clotrimazole a big problem? No, primary resistance is very rare, and secondary resistance has only been reported in isolated cases during treatment. What happens to clotrimazole after vaginal application? Only a very small portion, about 3 to 10% of the dose, is absorbed into the bloodstream. How does the body handle the absorbed portion? Any absorbed clotrimazole is rapidly metabolized in the liver into inactive metabolites, so it doesn't usually cause systemic effects. What are the blood levels like after application? Even after a 500 mg vaginal dose, peak plasma concentrations are less than 10 nanograms per milliliter, which is very low and not likely to cause side effects. Is clotrimazole safe in terms of long-term toxicity? Yes, animal studies on repeated doses, cancer risk, and genetic damage show no special hazards for humans. Does clotrimazole cause birth defects in animals? No, it was not teratogenic in studies with mice, rats, and rabbits. Were there any risks at very high doses? Yes, in rats, very high oral doses caused maternal toxicity, embryo toxicity, reduced fetal weights, and decreased pup survival. Does clotrimazole pass into breast milk? Yes, in animal studies it was secreted into milk at levels much higher than in plasma a few hours after administration, though the levels later declined. How should the product be stored? It should be stored below 30 degrees Celsius, away from moisture and light. Why is proper storage important? Because exposure to heat, light, or moisture may reduce the effectiveness of the tablets.